Hello, my name's Kate Walker. I'm a consultant obstetrician in Nottingham and I'm the clinical chief investigator for the GBS3 trial. Thank you so much for taking part in the trial and for your support. I'm just making this very short video with just how I approach women about having a GBS test and the information that I provide in clinic. So I normally start by just saying Group B strep is a really common bacteria that lives in a quarter of all pregnant women's vaginas and guts, and it doesn't usually cause symptoms. It's not usually of significance other than when the woman is pregnant, because the bacteria can be transmitted usually during birth to half of all babies where the woman carries the bacteria. The vast majority of those babies remain well, but a small percentage, about 3 in 100, will develop an infection, and that usually manifests as either pneumonia, an infection in the lungs, or meningitis, infection in the linings of the brain. Those infections can be really serious, and babies can be left with long-term disability and can even die from the infection. At the moment in the UK, we don't offer routine testing for Group B strep during pregnancy, although that's very commonly done in other parts of the world. And that's because the UK doesn't have enough evidence to determine whether GBS testing should be offered to all women, and that's where the GBS3 trial comes in. So the GBS3 trial is a really big trial that we're taking part in this hospital, and because we're taking part in that, we are able to offer you a test for Group B strep. We normally offer that test from 35 weeks onwards, and it's a really simple, easy test. It just involves putting a swab very gently into the lower part of the vagina and then into the lower part of the back passage. The same swab, vagina first, then the back passage. I can either do that swab for you or you can take the swab yourself, and our research has shown that it's just as good for you to take the swab as for me to do it for you, so really whatever you prefer. We'll get a result in about 72 hours, and if you test positive for Group B strep on that swab, we will offer you antibiotics through a drip in the back of your hand in one of your veins during labour, which reduces the chance of your baby developing an infection by at least 90%. So I really hope you'd consider having a swab done today, and happy to answer any questions. So that's my kind of usual spiel for women about the GBS3 trial. I hope it's helpful. We've also got a script that you can have a read of and keep saved if you just want an aid memoir for when you're in clinic. We know that about 85% of women so far in the trial are accepting a test, so really high rates. We're just not always offering every woman a test. And we know that we've had formal complaints from women who haven't had tests offered to them. There's also been HSIB reports where babies have suffered really sad adverse outcomes from GBS infection, which could have been prevented had the woman been offered a swab. So thank you for absolutely everything you're doing to support this trial, and please continue to encourage colleagues in your hospital to offer a test to all women who are eligible. Thanks so much.